For the next concept which we are looking at as related to obstetrics and gynecology, is to be talking about what is known as a parametritis. Talk about what is known as a parametritis. Okay. So when you say parametritis, what do you actually mean by that? Okay. So parametritis, you should know that it's an infection or inflammation of the parametrium. So what's the parametrium? Parametrium is that connective tissue surrounding the uterus. Okay. So parametritis will usually come in if there's pelvic inflammatory disease, or maybe there's trauma to it because of childbirth, or maybe some surgeries that were done in the reproductive system. Do you understand? So parametritis is kind of like, connective tissue all around the uterus. So sometimes it's not the uterus that is actually inflamed, but of course, if there's inflammation of the connective tissue, can actually spread to the uterus. Do you understand? So they are linked. So what is parametritis? Parametrium is the fibrous tissue that supports the uterus and connects it to the surrounding pelvic structure. So when it becomes inflamed, that's why we say parametritis. So I've actually spoken about the various causes. So causes again, we're talking about the activities that can cause it. Now the organisms. So bacterial infections from chlamydia trachomatis or cesarean gonorrhea. Maybe there were infections after the person gave birth. Post-abortion infections. Then contaminated surgical instruments or poor hygiene. Okay, when any procedure was done. Okay. So symptoms. There's pelvic pain. If it gets into the blood, there's fever and chills. There's abdominal tenderness. There's abnormal vaginal discharge. If you try to urinate, there's so much pain in that. Then the person is feeling generally unwell. Okay. So if you want to diagnose this, pelvic examination just for access for the tenderness and swelling. Blood test because you want to dictate the infection markers. Then you can image just to rule out the abscess and all. Then microbiological cultures just to identify the microorganisms that are actually causing the issues. So if you, mostly it's caused by bacteria. So antibiotics are a drug of choice, and the disease condition is being led by pain. So you use pain management, So you can still hospitalize the patient. Sometimes if there's accumulation of pus, you can surgically, drain it out.